Okay, hi, I'm Dr. Nation. I'm going to record the first part of the first 4 health assessments for Nursing 340L. We're going to start with skin, hair, nails competency. We'll then move on to the second one, which will be face, head, neck, lymph competencies. The third one will be ears, eyes, nose, throat competency, and then we'll close out with the respiratory competency. So I would first start, if I'm for hair, skin, hair, nails, by introducing myself to the client. Hi, I'm Austin. I'm going to be your nurse today. How are you?
I'm good. How are you?
Good. What brings you in today?
I just wanted to do a standard checkup.
Just a standard checkup.
Yeah.
Okay, so thank you. So I'm actually going to start with doing an assessment of your skin, hair, and nails. And I'm going to start with just doing some basic inspection of Jonathan's skin. I'm going to look at the color. Like he has his color is pink. It's normal for his ethnicity. You can just stay in the camera for me. His skin looks clean. I'm looking at his vascularity. I don't note any kind of abnormalities. I'm kind of looking at here. I'm looking at all the skin that he's giving me that is exposed. I'm just doing my inspection at this point of just his skin, right? I'm not noticing any particular lesions that I really want to take note of. No kind of discolorations, no swelling, no redness, no other abnormalities noted. I'm going to look for inspection of his scalp. I'll just do kind of a cursory look of the scalp. And I'm not noting any, again, lesions, discolorations, no swelling of his scalp while I'm taking note of it. Again, this is just for my inspection skill with him. And then I can come down and look at his nails, and I see that his nails are clean. The color looks pink. His angle of attachment looks to be slightly rounded. There is no concaving, no clubbing. You're fine, you just relax. No kind of abnormalities of the nails noted. That is just the inspection portion of the exam. So now if I want to start with my palpation, and I can go again anywhere that I want to go. And again, I'm going to start with skin. I can just go here by checking his temperature is nice and warm. Skin is dry. Skin is soft. There's no moisture. It's warm to touch. What else could I say here? Color, consistency. Let's see. There's no scaling. There's no flakiness. I could also then go up to, I could also then, while I'm here, check for edema. I don't know if I probably need to come down a little bit there. I can push here and check for edema. There's no edema. I could also check his nail bed here while I'm here. Capillary refill is less than 2 seconds on both sides. So I'm always wanting to compare left to right. No edema on both extremities. You'll also check lower extremities. We're going off, I don't want to go off camera with you too much as we're doing this, but you want to palpate edema in all extremities. Let's see, I can palpate palpate nail beds for any kind of other ridging as well. So I'm just checking that they again are smooth on both sides. And I'm noting that they are smooth. And again, hands are warm on both sides as well. Tugger, I could also check that here on the forearm while I'm here. There's a good skin tugger. Skin rebounds nicely on both sides. And then I'm going to come up, and I think I want to go next to palpating here my scalp a little bit. First, I'm going to start with a general palpation of the scalp, just to see if you have any tenderness, let me know. All right. Just kind of, he's not having any tenderness. There's no nodules. There's no areas of tenderness or softness. I can see that his scalp is nice and clean and clear. There's no kinds of infestations in here noted. There's no flakiness. There's no dryness noted in the scalp. Hair is nice and clean, has good luster. It's well kept. There's no dandruff. There's no flakiness, right? Just noting my observations. Hair has nice brown color. It's fairly medium texture. It's kind of like a medium to coarse texture. It's evenly distributed throughout his whole head. Lucky fella. Let's see, what else can I mention here? Let's see, I think that was actually pretty good off memory. Let's see. I think that's pretty good on there. 1, 2, 3. Okay, so then I'm responsible here for finding my lesion. Do you have a lesion or sore somewhere that I could talk about or measure? This is what you have to do with your clients as well. Let me come back down into the camera. Because sometimes you have to ask them for one.
No, I do not.
You don't have a lesion at all? You can give me. You have a scar? A little sore?
Hand, but not on...
Okay, you got one? You can show it to the camera? Which one are you showing to? Point it out so we can see it. Put it to the camera right there. See if we can
the
get
scar right there across the hand.
There you see it? Okay, good. Okay, so y'all can see it kind of sort of on there. Okay, so I'm gonna look at it. So let me see what he's talking about. So you talk about this scar here. So I would probably say he has, he's describing a 1-inch scar on his right hand on the dorsal palm side, right at the base of the hand near the wrist. God, I'm rusty on this myself. Like I said, it's about 1 inch. It's healed. It's soft. It's not hard, so there's no keloid or anything going in there. And that's, what did I get most of that? Size, description, location. There's no tenderness. There's good warmth, and there's no drainage. I thought that's pretty good. Okay, that was actually pretty good. Okay, so I'm gonna do a quick pause there. Let's do a quick pause there. And that's assessment 1. Okay, second one we're gonna go with is we're gonna do the head, face, neck, and lymph competency. And I'm gonna start the same way, introducing myself to the patient. Hi, I'm Austin, I'm gonna be your nurse today, and we're gonna be doing an assessment of your face, head, and neck, and your lymph nodes, which are kind of the little nodules you have under your face and head and neck area. What brings you in today?
Just a standard checkup.
Just a standard checkup.
Yeah.
Great. I forgot to end my assessment, by the way, last time, so you guys should probably dock me a point for that because I didn't end properly. I just thought about that. Okay, so I'm gonna start with my inspection. And Jonathan, you go straight in the camera. I'm gonna just look with you this way. I think I can do this one this way. So I see facial symmetry. I see no drooping. I see neutral expression. Can you smile for me? Can you puff your cheeks out? Okay, so that's telling me the cranial nerve 8 is intact. Can you, he's talked to me already and answered my questions, so I know cranial nerve 5 is intact. Can you feel this sensation here on your face?
Yes.
6 places here?
Yes.
What about over here?
Yes.
And over here?
Yep.
And here? And there?
Yes.
Okay, so that tells me that the rest of the cranial nerve 5 for sensation is also intact. I'm gonna move on now to, I'm gonna go ahead and just, I think I'm gonna get up for this part so I can show you this properly. I'm gonna try to show you this as it has been indicated for us to try to do this. I'm gonna try to play this into the camera. And so, inspection, if you can just lift your neck up for me, please. Okay, God, he has a nice neck. So that neck is really nice. I can see that there's a nice midline trachea here. I can feel my thyroid cartilage here. I can come down to my cricoid cartilage here. Can you swallow for me? Right? I can feel the swallow. So I'll go into position afterwards. With just inspection of those structures, I did not see any swelling. I didn't see any goiter. Trachea is in midline. You can go back to neutral. Trachea is in midline. There's no deviation of the trachea. No difficulty swallowing, which is also one of the cranial nerves. I'm not remembering what it is, but I know it's one of those cranial nerves that has to do with the tongue and glossal, which we're not doing on this inspection, but he just did it, so I know it's good. So I'm gonna start now with, while I'm here and I'm touching his shoulders, I'll go ahead and have him push against my shoulders while I'm here. So that tells me that the spinal accessory cranial nerve is intact. And while I'm back here, I think I will just go ahead and do the positioning to really be able to check more thoroughly his thyroid. So I want to make sure that I'm going in there low once I've identified those structures. Tilt your head back just a little bit for me. And then as he swallows, swallow again for me. I'm looking to feel if I feel anything coming up. So I didn't feel any kind of thyroid nodule or anything come up in the thyroid area as he swallowed for me. So that would be that everything with that area is negative. While I'm here, I'm gonna just go ahead and do my check of his lymph nodes. So I'm doing, it's funny doing it on someone else, I'm just doing it on myself. I would start with his preauricular, turn sideways for me a little bit so they can see. Preauricular in front of the ear. I'll come around backwards, postauricular. Oh, that's a good view. And then I will come back to his occipital to be checking for lymph nodes. I'm gonna slide up here to his mandibular angle. I'm gonna check to see if he has any tonsillar lymph nodes. And I'm gonna go submandibular underneath. And then I'm gonna go submental, turn forward for me. This is good, we're playing to the camera. Submental here, good. And then I'm gonna come back and I would feel in here, his anterior chain, that part in front of the neck. I'm gonna come back, go sideways again, so they can play to the, no, turn sideways. Posterior chain, because you can feel the muscle right here. Come back behind, palpate for posterior chain, and then forward one more time, and then right above his supraclavicular area to see if there's any lymph nodes in this area. And so I have palpated all of those areas, and there are no nodules, swelling, or tenderness or discomfort that he has identified on, according to facial grimacing or anything, on palpation of all of the lymph nodes. That would be how I would report that out. And thank you for letting me do this assessment. That ends our assessment of the face and the head, the neck, and the lymph nodes. It's been a pleasure. And I actually ended that assessment properly, round 2. Okay, so for this part of the assessment, we're going to be talking about the eyes, ears, nose, and throat. So we're moving on to the next part of the competency. So again, I'm going to have Jonathan just look into the camera, and we're going to just do a kind of a general inspection of his eyes and lids. I don't see any drooping of the eyes. The eyes look symmetrical on both sides. I don't see any discoloration of his sclera. There's no jaundice. There's no redness. I can tell this is just my inspection skills. As I look at his ears also look symmetrical on both sides. The external meata are also the same on both sides. The color looks good. There's no cerumen, which is wax, noted on either the left or the right, because we always have to compare left to right. I'm not looking at his nasal area. There's nasal area is symmetrical. There's no deviation. There's no flaring noted. There doesn't seem to be any problem with his color of his nares. There's no lesions noted of the nares. And that covers pretty much all of the inspection area. So I'm going to start with doing some palpation. I will start with doing, let's see, where do I want to start with? Since I just did my hand sanitizer over there, I'm going to start with palpating his tragus to see if you have any discomfort when I pinch his tragus. Tragus is the area, the little area inside the ear. So a palpation of the tragus, there's no tenderness to palpation of the tragus. I'm going to whisper a word in your ear and just tell me what that word is, okay?
Baby.
Good.
School.
Good. Okay, so he's heard both words, which lets me know that cranial nerve 8 is intact. Let's test for nasal patency, if you can just breathe in and out there. And what about over on this side? So nasal patency seems to be intact on both sides of his nasal passageway. And while I'm here, I'm going to go ahead and do this on camera for you to just palpate here. Any tenderness in through here?
No.
Okay, so he has no tenderness of the frontal sinus area. Let's see. You guys, I just realized I didn't cover mouth earlier either. I just noticed that. So, okay, so we will start with going and doing the assessment of the eyes. Let me go back up. And this is when I'll go in camera. So we're gonna start with cranial nerve 2. And this is when I would use my little handy dandy light here. Jonathan just showed me how to use. And I'll be in the first setting to make sure it's low. And if you can just kind of stare, find you a point in the distance to stare at. And I would come in that way, left, and come in from the outside of the eye. And you're just noting pupils are equal round reactive to light accommodation on both sides. I would take note of that. And so that tells me that cranial nerve 3 is intact. If you can just follow this pin, this is the 6 gazes test. I'm going to try to do this so it looks to you on camera. So if you can follow me here, just with your eyes, over there, good. And up over there, good. And how about up over here, good. See the gazes? Down, back to north center, and then over here. Okay, that is 6 gazes, is cranial nerves 3, 4, and 6, extraocular movements. He does all 6 gazes correctly. There's no difficulty, there's no nystagmus, which is kind of like an eye twitching thing that I would be looking for there. Then I'm gonna come down and I'm going to, the part that I realized we didn't cover earlier, y'all didn't even mention it to me, was I was supposed to look at mouth and throat. So again, I'll go back to my trusty little light. And see, if I was rehearsed, I would have done this all while I had my little light on. If I could have him say, look in at his mucosa, is pink, moist. All of his dentation, which is all of his dental work, seems to be intact. I didn't see any lesions inside of there. I can't see tonsils too good without a tongue depressor. And I'm gonna have to do fudge on some of these other, he said so we got the phonation. I could see the uvula lift up, which would be cranial nerve 9. Can you stick your tongue out? To the left, to the right? There's cranial nerve 12, that tongue protrudes. And then cranial nerve 10 is intact because again, he's talking to me. I don't necessarily need to gag him to do a gag reflex. And thank you, that concludes our assessment of the eyes, ears, nose, and throat. It's been a pleasure. Okay, and we're gonna record the respiratory competency, the last part of this for the first half of the course. So again, I'm gonna start with introducing myself to the patient. I'm Austin, I'm gonna be a nurse. What brings you in today?
Just a regular checkup.
Regular checkup for things, great. We're gonna be checking your lungs. I'm gonna be checking your lungs front and back today. Ensures that there's privacy here. And then we're gonna just start with just a general appearance of skin as it relates to respiratory effort. His skin is nice and pink. There's no discoloration of the lips, no cyanosis. There's no nasal flaring, which again speaks to respiratory effort for me. There's no pursed breathing, right? His respiratory effort looks unlabored and easy. Does not look unlabored. His skin is clean. I don't know why they want to know that, but I'll go along with this because this is part of my inspection right now. His chest wall looks symmetrical. I'm looking at it on your screen as well as I'm looking at it here. His chest wall looks symmetrical on both sides. Turn sideways for us so we can see the side view as well. So we're looking at anterior posterior diameter. It looks great. Is there a way you can flip back so we can see the back side? How can you do that? Okay, just maybe straddle or go on the edge of the seat. Great. Okay, great. And there's the back side. So while I have you here, I'm gonna go ahead and just do a couple of things while I have you in this position. I'm gonna go ahead and check for your expansion here. We talked about this earlier. You wanna give me a big breath in and out? Oh, look at the fingers move, right? Good symmetry. Okay, just one breath is good. Good, so he has good diaphragmatic expansion. It is symmetrical on both sides. I'm gonna go ahead while I have him in this position to go ahead and do some auscultation while I'm back here. I'll be listening with both the bell and the diaphragm. I'm gonna start with the diaphragm, or start with the bell, and I'm gonna start high up here, the apex of the lungs, the top. If I can have you breathe in and out through your mouth. Good, and compare it left to right. Great. I wanna make sure on the back that I skip the scapula, his scapula, the great scapula, and I can almost mark his scapula where they come. So I don't wanna put my stethoscope right on his scapula. I wanna come off to the side of the scapula for my next lobe. If you can give me a breath. Great. And the same thing on this side. Breath sounds are nice and clear over here. Down lower, and on this side lower. Okay, breath sounds are clear to auscultation bilaterally in all quadrants. Okay, now I'm gonna flip it to the bell side and do the same thing. Go ahead, breath in and out. Just to hear the difference, and again, good, nice and clear. Go ahead, upper lobes, go ahead, good. And one more, and let me come down lower. Base, nice. And nice, okay. Breath sounds are clear in all quadrants. I actually did, on this side, I actually did 4 instead of 3. It says they want you to do 6 minimum. I did here, 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 and low, right? So do it and make it your own. While I have him here and while I have the stethoscope here, I'm going to go ahead and have you say the word E and just hold it. Okay. Good. And you say 99 for me.
99. 99.
Okay, great. And while he's here, I'm going to go ahead and just kind of feel for the tactile fremitus, a 99.
99.
And see if I feel anything, 99.
99.
Okay, I don't feel anything there. Okay, perfect. Now, if I could just have you, while he's back here also, I'm gonna go ahead and do my little percussing, right? I am right hand, so this is my dominant hand. I'm gonna go ahead and there. Actually, I'm doing that wrong, so let me start again. I should be comparing left to right. Here, and then come over to the other side. Okay, good. 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 And again, staying off the scapula. Good. Sounds the same. And they sound equal bilaterally in all the areas as far as posterior lung resonance. Okay, I'm gonna have you turn back around. I'll do the anterior side. And when you come back around, I'll also, before I go back to stethoscope again, they're wanting me to check your nails. Nail beds are smooth. Capillary refill is less than 2 seconds, 1001, 1002. Nails are smooth, they're not concave. There's a slight curve to the nail. The color is good. Upper and lower extremities, you'll check those. And then the same thing with doing breath sounds on the front. And we'll start with anterior breath sounds, again, bell and diaphragm. And I'll start up high again, if you can give me a breath in and out. Good, and over here. Good, and here. Good. Okay. Good. 3, and down low. Okay, and then flip over to the bell side. You okay? Don't get lightheaded?
I'm okay.
Okay. And again. And again, oh wait, that's not good placement. Okay, there. Good. Nice. Good. Okay, breath sounds are clear to auscultation in all quadrants with both the bell and the diaphragm. There's no adventitious sounds in any quadrants. That's pretty good. So, and I should, did I do everything? Oh, I need to percuss my anterior. So I would same thing, dominant hand. I could percuss here. Sounds exactly the same. Good. I'm gonna go down low. And that sounds exactly the same. So percussion in all anterior lung fields have resonance, equal resonance bilaterally in all upper, lower, and middle quadrants of the lungs. And I think I feel good about that recording of the respiratory competency. Thank you. That concludes the assessment of your respiratory system. And that was awesome.